What is your perspective on integrating psychodynamic therapy with cognitive therapy?
Yeah, so this actually addresses a much broader question, and that is, what decisions do you make when you're going to do psychotherapy? So it's not just a question of integrating two things. So there are a variety of methods that you can use, and where some of the standard cognitive techniques have to be supplemented by techniques from other systems of therapy, where this occurs is particularly in the personality disorders. So when a patient with personality disorder comes in and is really quite upset over things, you use soothing techniques. You don't go immediately into the beliefs. Now, where would psychodynamic therapy come into the picture? Well, there are several facets of psychodynamic therapy that are relevant. First of all, one of the cornerstones is the transference. So you got to think of the transference. Another thing that we've learned about personality disorders is that much of their preoccupation has to do with childhood events. So that's the second thing. The third thing that is relevant to psychodynamic therapy, which you might use, are dreams. Ordinarily, you don't have to bother with dreams. So, first of all, I can give you an example of a patient who went through kind of the basic cognitive therapy methods, but she still was very self-critical. It turns out she's somewhat borderline. And so what we did is we reproduced in the session interactions she had with her mother after her father had died. And I could go into more detail
when she was a
that
child.
Later.
Yeah.
When she was a child, right. So the father died when she was a child, and now she is having a lot of reactions. Now that she's 25 years old, she's still reacting in some ways as she did with a child. So you do have to go back and work through the childhood trauma with her. The next thing is, with many of the borderlines, they form a transference to you even before they've seen you. And so they might be angry, or they might be dependent, or oftentimes they switch from dependency to anger, to distancing, and so on. And so, given that, you do have to work on the patient's reactions to you, which are generally conditioned on past experiences that they have had. So that's how you integrate psychodynamic therapy into the cognitive model. But you decide to do that based on your formulation of the case. You don't just willy-nilly say, well, with every case I'm going to put in psychodynamic therapy, because in many cases it's not necessary to spend time going into the past. And with many patients, if you spend a lot of time on the past, that's all they're going to think about, and they lose track of what's going on in the real time. So to integrate it, when you're talking about the past, you have to go into the past experiences and then try to establish how past experiences relate to what's going on in their life right now. Or you can take what's going on in their life right now and go back to the past experiences. And then they have to unlearn, through this method, they have to unlearn the beliefs that they established when they were children or adolescents. So it's an unlearning process that takes place, but it also has to be tied into current relationships. If it's not relevant to current relationships, why waste your time on it?